The views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, everyone. Welcome to Mission BX. Mission BX is a collaboration between BronxNet and the Center for Bronx Nonprofits at Hostos Community College. And I'm your host, Eileen Newman. We go behind the scenes and look at the work of nonprofits in the Bronx. And today we're going to be visiting with Michelle Jackson from the Human Services Council and Maria Lizardo, who's the Executive Director of the Northern Manhattan Improvement Corporation. They have just worked with many people on a task force report that looks at the status of nonprofits during the pandemic and beyond. So join us for a fascinating conversation about what the status is of those nonprofits working so hard to make life better in the Bronx. Hi, everyone. It's Eileen Newman from Mission BX, your host for today. And today we're going to be doing something a little bit different. We're meeting with two directors of very special nonprofits, and they're going to be talking about a study that they've been doing and that they've put together with a lot of other people about the status of nonprofits during the pandemic and now. This is something that we don't often look at, and I think it's a very important piece of information that I wanted to share with you. When I heard the results of this report, it was upsetting. It wasn't anything that I thought was so surprising, but I thought people just need to know this, and they need to know about the work that these nonprofits are doing. So today we're with Maria Lizardo, and Maria is with the Northern Manhattan Nonprofit Corporation, and they also have an office here in the Bronx. And we're also talking to Michelle Jackson, and Michelle is with the national, not national, I always think of it as national, the Human, because it should be, the Human Services Council. So Maria, can we start with you, and can you tell us about this? It's a little unfair to have Maria just talk about her organization, because if you know Maria, you know she does so much that we could have a whole show on what Maria does. So Maria, can you just tell us about your organization?
Sure. Thank you, Eileen, for having us today and for covering this very important topic. So I'm Maria Lizardo, the Executive Director at NMIC, and don't let the name fool you. Since 2016, we opened an office in the Bronx at 8 Clinton Place because we were seeing that Bronx residents were coming into Upper Manhattan for services. As a settlement house, it is so important for us to be embedded in the communities that we serve, and our services really touch across the lifespan of the individuals and families. So as we say, from twinkle to wrinkle. So NMIC provides services to 14,000 community members. 2,300 of those are Bronx residents and natives. And our core services focus on housing, benefits and finance, immigration, community health, education and career services, and holistic services. And we're a proud and active member of HSC because we recognize the importance of strengthening the sector in order to provide even more critical services to New Yorkers.
Great, thank you. And Michelle, can you tell us about the Human Services Council and what your work is, and then we'll move into the task force report.
Absolutely. Thanks so much for having me. And it's so nice to be joined by one of my members and board members, Maria. The Human Services Council, HSC, we represent about 170 human service organizations in New York City. And when we say human service organizations, we represent a really diverse network of organizations that range from childcare centers to senior centers, mental health, homeless services, everything in between. So we have a really broad network. And HSC focuses on city and state policies that impact the sector. Our nonprofits are heavily funded by city and state government contracts. So the relationship between government and nonprofits is really crucial to our communities in New York to make sure that they have quality services. And at HSC, it's our job to try to make that relationship better, and to improve both the procurement and contracting process and how nonprofits get paid. And also a big part of this report, which we'll talk about, is workforce, the workers at nonprofits, and how government pays or doesn't pay them appropriately for the work that they do.
So that gives us a hint about what the results were in this report. So Michelle, tell us a little bit about the genesis of the task force report, how this idea came about, who was part of it, how you picked people to be part of it, or they volunteered.
Yeah, so HSC has done a couple of reports previous to this report, and one of the areas that HSC focuses on is emergency response and disaster preparedness for the nonprofit sector. We typically think of like Hurricane Sandy or localized disasters like the Lower East Side explosion. Those kind of disasters impact communities, and therefore nonprofits are both the victims of disaster, like Hurricane Sandy. They have, their sites are flooded, or they're also first responders. Community members go to them to ask for help, and then they become shelters. They hand out food and blankets, etc. So that's always been a part of our work. And with COVID, COVID was a very unique and still is a long-standing disaster. We pivoted to that role to get our providers information, right? From day one, it was like, what is COVID? How do we protect our staff? Do we stay open? Oh, we're closing. How does that work? How do we serve people when we can't close? And so HSC took on that role and also played the role of liaison between government and nonprofits to say, what is government asking nonprofits to do, and what are we hearing from the community? During that, of course, nonprofits had their own struggles with cash flow, with trying to reach hard-to-reach communities, many different issues. And it became pretty clear that, to me, a lot of the issues that we had before COVID were just exacerbated, right? Like all of the issues that nonprofits and HSC have been advocating around low-paid workforce. This is now an essential frontline workforce during COVID who aren't being paid their worth. People are being paid late. Now, that lack of cash flow is impacting their ability to expand services and food pantries, which Maria, I'm sure we'll talk about. And so we thought we really need to bring together a smart group of people to say, if we look at recovery, there is no recovery without nonprofits for New York in so many different ways. And so we brought together our two really great co-chairs, Fred Shack, the head of Urban Pathways, a homeless service provider in New York City, who's on our board, and Jamie Rubin from Meridian, who's from the business community but has a long-standing relationship with nonprofits, and a really smart group of HSC members, philanthropy, business community, labor, the whole list of our task forces on our website, to really think through like what were the biggest issues that nonprofits face, and what are some new ideas for how we can recover and change the way that the sector and government interact so that we can better serve communities.
So this really became an excuse to do work that you probably have been thinking about for a long time. In terms of
what we were kind of hoping, we wanted to put everything on the table, right? Like, should we, how the results ended up like being what I said, which is that most of the same issues were exacerbated, but we did take it as an opportunity to say, here's a really smart group of people. What should we be doing differently? Are there different issues that HSC should take on? Should the sector be doing things differently? Like, let's put everything on the table. One of the big questions we asked at every meeting was like, what's new? What's innovative? And I think that's an important conversation for the sector to have. And we didn't come back to the same issues lightly. Like, we really pushed ourselves to say, is there something else? And at the end of the day, from the data, we did a big survey of our members, which we can talk about some of the data points, it just became clear that the cracks in the relationship between nonprofits and government were just becoming chasms. And we couldn't move forward as a healthy sector without addressing those.
And Maria, let's go to you. Why did you get involved? Why did you feel that you wanted to, with everything else you're doing, that you wanted to take on getting involved in this report, which clearly was a major undertaking?
I mean, I have been with NMIC now for 23 years and almost 7 years as an executive director. And I struggle to accept, and I am pissed at the relationship that we have with government, which includes paying us 80 cents on the dollar. So you're asking us to provide a service and you're only paying us 80 cents. Would you pay a contractor, a for-profit contractor, 80 cents to build 80% of the bridge? No, you wouldn't. You would pay them to build the whole entire bridge. I'm also appalled at the conversations that we're having about race and equity, yet our workforce, consisting of 80% people of color and 80% of those are women, are not being paid an equitable wage. So how can we have a conversation about equity when we're not investing in our workforce and making sure that they are making a living wage in order to live in New York City and thrive? And then third of all, when you're owed millions of dollars for services that you have already rendered, it is up to the nonprofit to deal with cash flow problems, to stress about the fact, how are we going to pay our bills? Our landlord is not going to say, I'm going to give you extra time because the city and state have paid you. No, we have to pay our bills. And when we tap into our line of credit, it's on us to then pay the interest. So basically, we're floating the city and the state and doing services for them as they do what they do with their money. So for me and for NMIC, this is an important issue that not only affects NMIC, but affects the entire sector. And during COVID, we saw how essential we really are, how we were the first front line of defense when it came to providing key services to many vulnerable New Yorkers. And so the city and state, they need to pay up and they need to pay attention to the sector.
So Michelle, how did you go about putting this together? And were people given certain tasks? Were they asked to speak to certain people? It's a major undertaking. So how did it all happen?
Yeah, so for everything in the last year, we did it all remotely. And so HSC and the HSC staff really took on the major responsibilities for moving the task force forward. And we brought in two really great consultants, Bennett Midland and also James Parrott from the Center for New York City Affairs, who are real experts in nonprofit work. And so we relied heavily on their expertise. The big components for us were the task force itself, which, basically I just called and to people like Maria and begged for some of their time, put together a really great group of people. And these are people who are really committed to the sector, so they were happy to make the time for the work that we were doing. And we use our consultants to really put together this really dense survey to our members. And I also have to thank my membership for taking hours out of their time, out of their days to fill it out. And we really felt like the data component was crucial. I think advocates are always starved for data and need to be able to really focus on what's crucial. And I don't think everything has to be numbers driven, but we really need to be able to have a snapshot of what happened to the sector during COVID and the real impact on people, workers, and budgets. And so for us, it was over the course of 6 months, bringing this really smart group together and having them move us forward with new ideas and kind of looking at what the survey should be, and relying on our members, as always, to come through, even when they're understaffed, overworked, and underpaid, to fill out information and put this together. So it was really a labor of love from the people who agreed to volunteer for it.
So we have to take a quick break, but when we come back, what I want to talk about and have you both talk about is what the key findings were. So that and also recommendations. So thank you. We'll be right back.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, this is Hostos.
Hi, everyone. Welcome back to a fascinating conversation that we're having with Maria Lizardo and Michelle Jackson. And we're talking about a report that came out of Human Services Council about the status of nonprofits, particularly during COVID, and the work they've been doing and the work that they are struggling to be able to do with a lot of barriers in the way. So either Maria or Michelle, can you talk a little bit about the findings, the pivotal findings that you found in this report, or that you created in this report that you found when you spoke to people?
Yeah, so I'll kick it off, and Maria would love for you to add some color for what that looks like at NMIC, because I think that's really important. I think for us, we broke it into a couple of categories. The findings, one is really around the impact on communities. So despite the number of fiscal, nonprofits enter the pandemic being owed millions by government and having underfunded contracts, but obviously the pandemic disrupted fundraising efforts, people who were, going to do in-person fundraisers. There was certainly an increased need. And what we found is that during the pandemic, 82% of our organizations actually launched new services. So despite fiscal challenges, they met community needs. 45% launched telehealth services, which no surprise there. And 72% of our organizations expanded existing services. And one of the biggest areas, 47% of organizations added food programs. Obviously, we all know that food during the pandemic became one of the most crucial issues. And Maria, you're one of those organizations. So do you want to add what that looked like for you?
Sure. So prior to COVID, we knew that food insecurity was an issue for residents in the Bronx as well as Upper Manhattan. And we had a partnership with the West Side Campaign Against Hunger, and they would bring their mobile food truck once a month, and we would serve 125 community members. Come COVID, we closed our doors on Friday, March 13th, 2020. And by May 8th, 2020, we were kicking off our food pantry. And what that looked like was totally different. And we relied on resources from volunteers, resources that were not covered by government or foundations at that time. And we worked with WISCA to expand our food pantry to doing it twice a month so we could serve 300 families a month. We also had to invest in technology. So we are able to enroll people online and in person at the food pantry. And then we do appointments for folks because we don't want folks to spend all day on the line. We want them to come at their appointment time, and we could do socially distancing. So we've invested as an organization time and resources that we did not have, but we needed to do that in order to pivot and meet the community need. And that has been across all nonprofits in terms of our huge investments that we have made to support technology, to support our staff, to support our infrastructure, because that is something that we normally don't invest in because we don't get paid enough to do that work. And so, but we've had to pivot in order to serve our communities.
So given that, how did you do it? Because was there any extra money? Were there any grants? Was there anything to help? I don't think everybody who watches the show necessarily understands the process by which nonprofits get funded, and that it's not like a business where you have a service and then someone pays you to do that. It's much more challenging.
I mean, at NMIC, we're 95% government funded, and so we heavily rely on government to support our programmings. But during COVID, I think we saw the generosity of individual folks who wanted to do something, who had not lost their jobs and who were still, that they had their income. And so they donated. We also saw foundations and philanthropy pivot from their norm, and really be creative in how they were funding and supporting organizations. And that's something that we need to continue those conversations. How do we continue to support nonprofits? But government still needs to step it up. It is their responsibility to fully fund these programs so we can meet community need.
And I think you probably found that in almost all organizations that I speak to, and we've had some of them on the show, who've never done anything with food before because it just wasn't part of their mission, were suddenly, in whatever way they could, bringing food. People from Mercy Center who were literally standing outside of their organization and handing bags of food to people. And you see it all over the Bronx. Do you still see that need as being as intense as it was?
Definitely. We still see the need. Folks are struggling. We have folks who are underemployed because restaurants didn't bounce back. They're not getting as many hours. We have folks who are still unemployed. And so the next chapter, what does that look like in terms of our workforce, and how do we connect folks to jobs that will pay a living wage? But in the meantime, they need to feed their families. So definitely food insecurity continues to be a huge need among our communities.
And included in this report are some amazing case studies. So, Michelle, can you talk a little bit about maybe one of the case studies that was that a light was shown on in this report?
Yeah, absolutely. I think our case studies, including one from NMIC, are really meant to like add that personal. When we talk about these big numbers and the recommendations for change, which are really geared towards government, like how do your viewers kind of understand what that looks like on the ground? And I think for us, the case studies, all of them, we really tried to put like a human face on, and in this case, like workers in the nonprofit sector and the work that they went through. And so for me, I think, if you look at the YMCA case study, for example, it's about this great guy, Frankie, who just went above and beyond to make sure that the kids that he had been serving and the families that he had been serving were able to get, he had to go into the shelters and set up his own Wi-Fi to help the kids sign up for daycare and for summer programs when summer programs were opening back up. And if you look at there's Volunteers for America, they really talk about how they were able to, the workers adding extra hours and showing up and doing things that weren't their job. And I really think also the Visions, which Vision serves people who are who are sight impaired or blind. They help people get jobs and stay employed. And, during the pandemic, obviously, most people's jobs looked very different. And they had a number of clients who got jobs at Amazon, and Vision staff accompanied them on overnight shifts during the height of the pandemic, just so that they could be, acclimated and learn how to do those jobs as people who are visually impaired and need that extra help. And they do that on some of the lowest wages in New York State, which I think is a really important component of the report that we put together and recommendations for change. We've all clapped for essential workers for a year, and human services workers have been left out of that. The state has left them out of recovery. The city has done a better job, but they're just, they're paid 70% of what they would be paid if they worked at government. Most of them, 15% of human services workers qualify for food stamps, and they're overwhelmingly people of color. The frontline human services workforce during this pandemic is 85% Black and Latinx. And they're some of the lowest paid workers in the state, as I mentioned. And I think that, one of the reasons we did those case studies was to illuminate these are people doing frontline essential work to help individuals and families recover and stay safe. And so we have to treat them better. And so that's really one of the cornerstone recommendations of our report is tying those case studies, those individual people like Frankie, to how government really underpays them on their contracts.
So speaking of recommendations, what are some of the other that you think are the most important recommendations that you included in the report?
Yeah, so
they're all super important. So.
I think that for us and the workforce recommendation really around lifting wages, government, and I think it's really important, government sets these wages on salary. So an organization like Maria's that's 95% government funded, government says, this is how much we think you should pay. And you can private fundraise to try to pay them more. But, if you say $35,000 for a social worker, by the way, if you're a social worker, you have to have a master's degree. So why does the government, the city of New York and the state of New York think that $35,000 is an appropriate salary for someone who's required to have a master's degree? And Maria being 5% private fundraise, how does she make up that difference? So for us, the workforce recommendation about how government needs to pay more for salaries and shouldn't be using government taxpayer dollars to fund poverty level wages is really important. So for us, that's the one that has the most bite and the most public. We want to make sure that the public understands that nonprofits are doing their best to pay their workers, and that government really needs to step up. And I think we all want to see people paid an equitable wage for the really important work that they do. I think for us also, when we look at the procurement system and why workers are underpaid and the struggles that Maria and other organizations had during the pandemic, the way we contract for human services is really broken. It's very wonky, but it's also not the most effective use of limited dollars. And so for us, we're asking, we'll have a new mayor in January. We have a new governor. And we're asking both of them, right? So that's, moves up that recommendation by a year. But we have a new governor who hopefully has a new agenda and will pay more attention to the nonprofit sector than the previous governor did. And so we're asking them to really embark on really technical, let's start over and make a system that makes sense to get the best quality programs out to our community.
So unfortunately, we just have a few minutes left. So in that few minutes, just tell me what are the next steps and who are you getting this report out to? Obviously, it's sitting on the desk of the new governor and it's sitting on the new mayor's desk. But what else are you doing to get it out? And what are your next steps in terms of?
Yeah. So we're certainly looking at the transition teams at both the mayoral and governor level to get it out to them. It's something that will be the cornerstone of HSC's advocacy in the next 2 years. Back in September, we'll follow up with you. We're going to be launching a huge public workforce campaign so that people can follow along and kind of support all of these recommendations, but certainly our essential human services workforce. So we're going to launch a very public campaign on that. And it will be, on every desk we have 30 plus new council members coming in. There's a lot of opportunity for change. And so we'll be pushing it with all of our new partners in government. And Maria will be at the lead of that as well, talking to her electeds.
So I'm so glad to hear that. And if there's any way that we can, through the Center for Bronx Nonprofits or through the show, get more information out, I so appreciate the fact that, I know within this how busy the two of you are. So even taking this time early in the morning to do this, I'm so appreciative. And more, I'm so appreciative of the work that both of you do and that the sector does. And it just the idea that people are not, who are doing for others, and that is what their world is and their job is, aren't getting paid enough money to have a real living wage. That's something that we all have to work on. And so I appreciate your time and your effort and all the hard work. And we'll be back to find out what successes you're going to have with all these new people. Who knew that you'd have a whole new group of people? So good luck with all of it. And thanks again.
Thank you. Thank you.
Unfortunately, that's all we have time for today. I hope you enjoyed the conversation with Maria Lizardo and Michelle Jackson. And if you want to learn more about the work they're doing, you can go on either of their websites. And if you missed part of this show or would like to see it again, go on BronxNet.tv and look for Mission BX, and you'll find this and other shows we've done. Thank you for joining us, and we hope to see you again when we visit another wonderful nonprofit in the Bronx.
Everything is here for the taking of breath. The only one is you, one it must be felt.